Well, welcome to another Better Health Together, and I'd like to introduce you to Dr Rohan Gay. We are in his practice here at Water Road East, so thank you so much firstly for having us.
Thanks for inviting me.
And we're going to talk about what I think is actually a bit of a tricky topic, and it's about general practice data. And we're talking about this in the environment of my health record and a whole range of other dilemmas that are underway around us. WAFA has a role in supporting general practice to assist them both clean up, manage and use their data well. And we see this role as critically important in terms of general practice. But before we move into that, would you like to just give us a brief overview of Water Road East?
Well, Water Road East is a small general practice. We are a teaching practice for both WAGPET and University of Western Australia and University of Notre Dame. So we have quite a focus on quality and trying to practice general practice as we believe it should be practiced.
Good. We might come back and talk to you another day about being a teaching practice as well. Why do you think general practice measuring using their data is important?
I think medicine at its heart is based on data. It permeates everything we do. When we're taking a history, measuring vital statistics and performing a physical examination, we are in fact taking data, and we are then placing it in the context of epidemiological data to form our diagnosis and then to formulate our management of those patients. So if we're really going to work on knowledge and data and not just assumptions, we need to be recording the data and as a real measure of how we're performing and whether we are performing to the best of our abilities.
Yes. If you were to say or to summarise the benefits for you as a practitioner in being able to use the patient's data well, what would you describe those to be?
It's efficiency. It allows you to go forward in patient management, not have to constantly have to reformulate a patient's status every visit. By measuring data and incorporating that into your recalls and reminders of patients, it really helps steer the patient along the management path that is efficacious for them. It also lets you know personally how you're performing according to measured expectations of best practice and allows you to adjust accordingly.
Well, we've talked about outside of this forum about the limitations of treatment plans, and while that's one part of a patient's story, do you use your data well to sort of hold the fuller information about a patient?
Yeah, there's a famous military saying that no plan survives first contact intact.
Right, yeah.
And that the value of a plan is a historical document, but the value of the plan is in the execution and the ongoing execution of the plan in the face of whatever might happen that might change the course of the plan. So yeah, a value of the plan is in execution and in achieving the aims that you set out in the plan, regardless of how things may change in the face of the data that you collect.
Yes. So, as you know, we work alongside your practice and you provide us great insights, but we also try to provide a service to you to help create reports around your data. Do you use those reports across the whole practice, and does the practice become engaged in the sort of overarching data?
I think everyone is aware that our approach to data collection and via data involvement of patients, we have a cohort of patients which is more heavily weighted towards a complex patient than other practices. And I think that's a marker of the success of that approach. We have also looked at our data, for instance, in terms of diabetes and measured our performance in terms of HbA1c control and measurement of blood pressure, albumin, and so on, compared to our cohort, and that's been very reassuring for us. So it does allow us to see ourselves in a wider context.
We're holding some data workshops, what we call data sharing, but it's really around working with practices and informing them about what we do to help them use their data well. But if you were to give 2 or 3 top tips to one of your peers about data in their practice, what would they be?
Enter measurements as data, not text.
Okay. 1.
Nail down how you're going to collect your data so everyone collects the same data consistently.
Yes.
And classifications. Unless you classify what you're seeing, you will never know what you're seeing.
Yeah, that's great advice. Thank you very much for that, for your words of wisdom and your insights. And it's been a pleasure being with you here today. Thank you very much.